Legends of Reddit. What was your oh moment? Story 1. Doing a C-section for this poor mum who'd been in labor for hours. Baby wouldn't come out of the hole we'd made, so more pressure was applied to the fundus, top of the uterus. And suddenly, whoosh! Baby zooms out like a torpedo, covered in lubricating vernix, zips over the surgical sheeting which has the texture of a slip and slide and almost rockets straight off the table. The baby's foot was caught by the reg, who whipped her up in the air upside down like in old cartoons, but almost dropped her again due to gloves plus vernix. Thankfully, the midwife was ready with the towel and caught the baby to wrap her up. Mum and Dad seemed to think this was normal practice and didn't notice, but me and my colleague just stared at each other with a look of absolute horror. It still makes me shudder to think how close the baby was to hitting the floor head first. Never happened before or since. Story 2. I was doing a corneal transplant when I had the oh moment. During surgery, I cut off the patient's own cornea and replaced it with a new donor cornea. During that moment when the host cornea was off, but before I could get the new one on, there's literally nothing on the front of the eye except a tear film and aqueous humor. Anyway, the patient takes that moment to start vomiting. The reason we tell everyone to skip food and drink is so they don't aspirate in case they throw up. This patient lied about eating breakfast and started throwing up everything. The eye is still open sky at this time. Everything inside of the eye can now become outside of the eye, and she's bucking and vomiting. Those not in the know will say this is not good. Those really in the know will say, oh. Anyway, I had to grab the new cornea and start stitching as fast as I could on a patient actively throwing up. I used 10-0 nylon sutures, which are thinner than an eyelash. It turned out okay, but not great. Don't lie about eating breakfast before surgery, folks. Story 3. Happened at my hospital. A mentally ill young woman who was pregnant at the time was in denial, locked herself into her room when she realized the contractions were coming. She basically didn't push, and the baby didn't come naturally. Her family called 911 because of the smell. The ER realized her baby had died inside her and was basically rotting due to the smell. She was taken to the OR to remove the baby, and apparently all the nurses and surgeons were vomiting, because once they opened her up, the smell was overpowering, and it was traumatizing to see a rotting baby. Edit. Not a surgeon. I'm a hospitalist physician. Story 4. Not a surgeon. Thought I'd share this, though. Husband went in for a routine colonoscopy, and as they were prepping him, anesthetist asked him if he's a ginger. My husband tells him, yeah. When he was a kid growing up, he had fire engine red hair, though it's faded to a more strawberry blonde now. The anesthetist laughs and says, okay, I gotcha. We'll give you the redhead dosage, and winks. Well, my husband thinks it's a funny, until he wakes up at the tail end of the procedure, pun intended, and doctors are just chatting it up and what have you. Turns out it's not a joke, and redheads have some type of natural block to anesthesia. Dude had given him max allowable dosage and he still woke up. Happened a couple years later. They gave him ketamine and some other to knock him out to get wisdom teeth out when he told dentist about the colonoscopy thing. He still woke up at the end of that one too. Story 5. Surgeon here. I've dealt with loads of morbid stuff, but one thing that made me stop and go, oh, was a conversation with a young patient who had a perforated colon from diverticular disease, which is a common wear and tear of the colon. He was one of youngest patients I had seen with this condition, and certainly the youngest with a perforation so bad as to require an operation. When I was counseling him on the operation, which involves removing the perforated part of the colon and giving him a colostomy, he told me his biggest concern was how he was going to have with his same partner. He would only have a small stump of rectum left inside, which would be at risk of perforation with any force applied to it. It made me really think about the implications of the surgery we do. The operation is the easy part. Story 6. When I was a new RN working the ICU in a large teaching hospital, I came into work one morning to a patient that was admitted that night. Intubated, breathing tube in, sedated, Foley catheter, tube and pee-pee hole, and all. Long story short, he was extubated, breathing tube out, that same shift and was completely alert and oriented. He was an end-stage renal patient, meaning his kidneys didn't work, and he needed dialysis, and was only in his late 30s. Said he never made urine anymore and didn't need the Foley catheter, so he wanted it out because it was hurting. Now the catheter bag had been empty my whole shift, which is normal seeing as how he didn't make urine anymore, and this hospital had a nurse-driven Foley removal policy, meaning while we needed a doctor's order to insert one, we could remove one at our discretion, unless a doctor specifically put in orders not to. This patient had no such doctor order, so I went to remove the catheter. They are held in the bladder by a balloon on the end that is inflated with 10 ml of saline. I de-inflated the balloon, removing 10 ml of saline, and pulled it out. As soon as the catheter left his penis, blood started pouring out in a heavy stream. Turns out the nurse who placed it on admission hadn't advanced it far enough, since there was no urine production to indicate correct placement, and had inflated the balloon while still in his urethra, causing trauma. It would not stop bleeding. I had to hold this man's penis shut to put pressure on it, while my coworker paged the resident, who came and looked at me with pity as he told me to just keep holding this 30-something-year-old man's penis in my hands to staunch the blood flow until urology could get there to assess. It just kept gushing blood every time I eased up to check. For over an hour total, I held this man's penis and tried to make polite conversation until the urologist arrived. Story 7. I'm not a surgeon, but when I was in med school, there was an oh moment for everyone, including the surgeons, anesthetists, nurses, and students. They were prepping a patient for surgery and put him under, and the nurse said, "Okay, he's out," before they were about to start slicing him open. The patient just had enough strength to move his head from side to side and said, "No, I'm not out yet." Everyone laughed it off, but if the patient didn't do that, it could have ended badly. Story 8. Not a surgeon, but was working in obstetric theater in UK mid-heatwave last year. This is important as maternity wards are kept quite warm, as newborn babies aren't good at regulating their temperatures. Combine this with a heat wave, and the fact that in Britain we're not exactly used to high temperatures, and we have the perfect storm. Mid-emergency caesarean. The scrub nurse assisting the op starts feeling faint. This is unusual, as this scrub nurse worked in these theaters full-time, so this was her bread and butter, so I can only conclude it was the heat. She has to step out, so the SHO takes her place, assisting the OBS registrar with the section. This SHO looked extremely junior, as in first section ever. And they were trying to assist with the instruments in the uterus when they fainted. I had to jump in and grab the back of their theater gown to stop them face-planting the open uterus, and then sort of gently tug backwards to let them fall into me when someone else has taken over assisting. This SHO was not exactly small. Thank God the baby was already out. Story 9. I was the patient. I had a liver transplant and was having an ERCP done to place a new bile duct stent. Well, apparently my anatomy is different than normal, and my lungs go more down my sides. So he accidentally caused a nick, which caused a hemothorax. So when I woke up, I couldn't breathe. They did an X-ray and had to do a chest tube. Eventually, I was so exhausted I asked to be vented, so he vented me. Apparently, he cried he felt so bad about it all. But it wasn't him being malicious or negligent. It was simply an accident. Story 10. Fifth-year resident here. There are lots of bad moments throughout training, such necrotizing soft tissue infections, or takebacks for bad complications or deaths during cases. However, I'd like to share a recent positive moment. 15-centimeter kidney tumor with thrombus into the vena cava. Big incision, great exposure of the vasculature and the tumor. My attending and I are dancing around the aorta and vena cava. We are able to feel the tumor thrombus in the IVC. I was expecting that we'd need to cut and clamp the vena cava to get all the cancer out, but my attending literally squeezes the tumor out of the vena cava back into the renal vein, and then has me tie the renal vein off so the tumor doesn't slip back into the vena cava. Patient went home in like 4 days. Margins were negative, and is still doing great. First time I felt like, oh, I'm a surgeon. Story 11. 8 years after finishing medical school and deferring student loans through residency and fellowship, and realizing that I was closer to 40 than 30 with over $200,000 of debt. Story 12. Heard an moment as a patient on the operating table. A couple of years ago, I was in labor for 28 hours, pushing for 6, when my child started showing signs of distress. He had slightly elevated heart rate, and I had the makings of a fever. My midwife at the hospital told me the doctor was coming in to check to see if a vacuum assist could help. She checks me and immediately stands up with blood on her hand and says, "We're going to the OR now." At that time, I started feeling that zoomed-out tunnel vision I know for me is shock. I had anxiety but figured she knew what was best. She did. We got in the OR 8 minutes later, and when they opened me up, I heard the surgeon say, "Oh, look at this." They say blood in my catheter bag, and upon fully opening me up, found my son was actually trying to come through my uterus. He had ruptured it. They got my son out. Those moments where he was stunned and not crying were an eternity. He cried, and he was born a completely healthy baby. After I woke up and was back in my room, the doctor came in and told me what happened. I knew a ruptured uterus sounded bad, but I Googled and started having a massive anxiety attack. A ruptured uterus is extremely rare and so very dangerous and often fatal. I read from the time it happens you have about 15 minutes before you bleed out and baby is dead. When I went back for my post-C-section follow-up, my midwife let me know, as a practice that's been around 35 years. With over 30 midwives and doctors, they had never once encountered that, and it was such a big deal for them. A few days after my birth, they all got together to discuss my case. I was so incredibly fortunate I chose to labor in hospital that the doctor just knew from my vitals and babies that something was off. They just didn't know until they got me open. I can't even tell you how grateful I am for Dr. S. You saved my life and my son's life, and our family would forever be grateful. Story 13. Not me, but my uncle. He's a respirologist and was sitting in on lung surgery to remove a tumor. Turns out the tumor was a root ball. Some type of seed had gotten into the patient's lungs and started to grow. Story 14. I had an ingrown toenail. It was supposed to be a quick fix. I was 14 and had my mom with me. They let an apprentice do the surgery and he goes, "Oh." The doctor in charge just laughed and said, "No risk, no fun." Turns out they fucked up my toe and I had to have 4 more surgeries to correct it. I cried. Story 15. I work in the OR and have seen some pretty interesting things. First day on the job, the surgeon was doing a lap sleeve gastrectomy. During this procedure, a medical device is used to cut and staple the stomach simultaneously. However, in this case, the medical device failed. The stomach was cut open, but the staples never engaged, which left the patient with an enormous gash in the stomach. The surgeon ended up finishing this part by hand. I got called into a room to ensure the laparoscopic camera was working and able to record. This was a 6-hour cardiac procedure and was nearing the end, so I knew I was about to see something good. The surgeon pulls out some kind of growth from inside this guy's heart. This thing was the size of a chicken wing. It was growing through his valve, and I'm honestly amazed they were alive. Supposedly, the only symptoms were shortness of breath. Story 16. Every time I see a question like this, it takes me back to one of the greatest Reddit comments in history. Or nurse here. This is kind of a long one. I was taking call one night and woke up at 2 in the morning for a general surgery call. Pretty vague. But at the time, I lived in a town that had large populations of young military guys and avid meth users, so late-night emergencies were common. Got to the hospital, where a few more details awaited me. Pararectal abscess. For the uninitiated, this means that somewhere in the immediate vicinity of the E, there was a pocket of pus that needed draining. Needless to say, our entire crew was less than thrilled. I went down to the emergency room to transport the patient, and the only thing the ER nurse said as she handed me the chart was, "Have fun with this one." Amongst healthcare professionals, vague statements like that are a bad sign. My patient was a 314 lb Native American woman who barely fit on the stretcher I was transporting her on. She was rolling frantically side to side and moaning in pain, pulling at her clothes and muttering Hail Marys. I could barely get her name out of her after a few minutes of questioning, so after I confirmed her identity and what we were working on, I figured it was best just to get her to the anesthesiologist so we could knock her out and get this circus started. She continued her theatrics the entire 10-minute ride to the OR, nearly falling off the surgical table as we were trying to put her under anesthetic. We see patients like this a lot, though. Chronic drug abusers who don't handle pain well and who have used so many drugs that even increased levels of pain medication don't touch simply because of high tolerance levels. We got the lady off to sleep, put her into the stirrups, and I began washing off the rectal area. It was red and inflamed. A little bit of pus was seeping through, but it was all pretty standard. Her chart had noted that she'd been injecting IV drugs through her perineum, so this was obviously an infection from dirty needles or bad drugs. But overall, it didn't seem to warrant her repeated cries of, "Oh Jesus, kill me now." The surgeon steps up with a scalpel, sinks just the tip in, and at the exact same moment, the patient had a muscle twitch in her diaphragm, and just like that, all broke loose. Unbeknownst to us, the infection had actually tunneled nearly a foot into her abdomen, creating a vast cavern full of pus, rotten tissue, and fecal matter that had seeped outside of her colon. This godforsaken mixture came rocketing out of that little incision like we were recreating the funeral scene from Jane Austen's Mafia, We all wear waterproof gowns, face masks, gloves, hats, the works, all of which were as helpful as rain boots against a fire hose. The bed was in the middle of the room, an easy 7 feet from the nearest wall, but by the time we were done, I was still finding bits of rotten flesh pasted against the back wall. As the surgeon continued to advance his blade, the torrent just continued. The patient kept seizing against the ventilator, not uncommon in surgery, and with every muscle contraction, she shot more of this brackish gray-brown fluid out onto the floor until, within minutes, it was seeping into the other nurse's shoes. I was nearly 12 feet away, jaw dropped open within my surgical mask, watching the second nurse dry heaving and the surgeon standing on tiptoes to keep this stuff from soaking his socks any further. The smell hit them first. Oh God, I just threw up in my mask. The other nurse was out. She tore off her mask and sprinted out of the room, shoulders still heaving. Then it hit me, mouth still wide open, not able to believe the volume of fluid this woman's body contained. It was like getting a great big bite of the despair and apathy that permeated this woman's life. I couldn't fucking breath. My lungs simply refused to pull any more of that stuff in. The anesthesiologist went down next, an ex-NCAA D1 tailback, his 6'2" frame shaking as he threw open the door to the OR suite in an attempt to get more air in, letting me glimpse the second nurse still throwing up in the sinks outside the door. Another geyser of pus splashed across the front of the surgeon. The YouTube clip of David at the dentist keeps playing in my head. Is this real life? In all operating rooms, everywhere in the world, regardless of socialized or privatized, secular or religious, big or small, there is one thing the same. Somewhere, there is a bottle of peppermint concentrate. Everyone in the department knows where it is. Everyone knows what it is for, and everyone prays to their gods they never have to use it. In times like this, we rub it on the inside of our masks to keep the outside smells at bay long enough to finish the procedure and shower off. I sprinted to the R Central Supply, ripping open the drawer where this vial of ambrosia was kept, and was greeted by an empty fucking box. The bottle had been emptied and not replaced. Somewhere out there was a godless who had used the last of the peppermint oil and not replaced a single fucking drop of it. To this day, if I figure out who it was, I'll kill them with my bare hands, but not before cramming their head up the colon of every last meth user I can find, just so we're even. I darted back into the room with the next best thing I can find, a vial of mastisol, which is an adhesive rub we use sometimes for bandaging. It's not as good as peppermint, but considering that over 1/3 of the floor was now thoroughly coated in what could easily be mistaken for a combination of bovine afterbirth and maple syrup, we were out of options. I started rubbing as much of the mastisol as I could get on the inside of my mask, just glad to be smelling anything except whatever slimy demon spawn we just cut out of this woman. The anesthesiologist grabbed the vial next, dousing the front of his mask in it so he could stand next to his machines long enough to make sure this woman didn't die on the table. It wasn't until later that we realized that mastisol can give you a mild high from huffing it like this, but in retrospect, that's probably what got us through. By this time, the smell had permeated out of our OR suite and down the 40-foot hallway to the front desk, where the other nurse still sat, eyes bloodshot and watery, clenching her stomach desperately. Our suite looked like the underground river of ooze from Ghostbusters 2, except dirty. Oh, so dirty. So. I stepped back into the OR suite, not wanting to leave the surgeon by himself in case he genuinely needed help. It was like one of those overly artistic representations of a zombie apocalypse you see on fan forums. Here's this one guy, in blue surgical garb, standing nearly ankle-deep in lumps of dead tissue, fecal matter, and several liters of syrupy infection. He was performing surgery in the swamps of Dagobah, except the swamps had just come out of this woman's, and there was no Yoda. He and I didn't say a word for the next 10 minutes as he scraped the inside of the abscess until all the dead tissue was out. The front of his gown a gruesome mixture of brown and red. His eyes squinted against the stinging vapors originating directly in front of him. I finished my required paperwork as quickly as I could, helped him stuff the recently vacated opening full of gauze, taped this woman's buttocks closed to hold the dressing for as long as possible, woke her up, and immediately shipped off to the recovery ward. Until then, I'd only heard of alcohol showers. Turns out 70% isopropyl alcohol is about the only thing that can even touch a scent like that once it's soaked into your skin. It takes 4 or 5 bottles to get really clean, but it's worth it. It's probably the only scenario I can honestly endorse drinking a little of it too. As we left the locker room, the surgeon and I looked at each other, and he said the only negative sentence I heard him utter in 2.5 years of working together. That was bad. The next morning, the entire department, a fairly large floor within the hospital, still smelled. The housekeepers told me later that it took them nearly an hour to suction up all of the fluid and debris left behind. The OR suite itself was closed off and quarantined for 2 more days just to let the smell finally clear out. Story by You Bonsai Panda. Story 17. My grandfather told a story about a clamp coming off an artery while he was pulling a kidney in rural Wyoming in the early 50s. The abdominal cavity was quickly filling with blood, and the nurse fainted. He was able to push down with his elbow on the descending aorta and got the clamp back on. Patient lived, but I think he chose his surgical assistants a little more carefully after that. Story 18. When I was younger, I had a rather complex external fixator, cage, applied to my leg. It had 3 rings, 2 large 360-degree rings around my leg, one in the upper middle of the shin, one and the lower, which had humongous rods to keep the cage fixed to my leg, and a third one, which was a horseshoe-type ring around my ankle, which threaded all sorts of pins through my ankle. Each pin set in a certain way. The point of this external fixator was to relocate and fix the positioning of my ankle. So it wouldn't be so fucked, basically. I have had a birth defect called talipes, clubfoot equines. A lot of bone got removed before the fixator was put on, so this way it could all grow. It was a 9-hour surgery, and my doctor, who I won't name, was pretty chuffed with himself after seeing it all installed on my leg. This was until he looked closer. The pins I spoke about before, with the numbers on them, almost like those sizing things on cheap coat hangers, were all colored and numbered, set for my dad to do every morning and night. He was looking at the pins and the numbers. He glance away and looked back with a stressed face on. After a few seconds and a slight hand-on-head gesture, he whispered. In his mind, he had organized the pins in an incorrect way. He was stressed beyond his mind for a few minutes. He was worried he fucked everything up. Luckily, he hadn't. He just needed to move 1 or 2 numbers. 1 year later, 8 months after the frame was taken off, which was in for 6 months, I ended up having my leg amputated. The surgery didn't work how we wanted it to, or at least how I wanted it to, which we were sort of expecting. The goal was to get me walking. The amputation got me running. Bear in mind, the amputation was my call. I was 12 when it was done. Best decision I ever made. Story 19. Not a surgeon, but I was having surgery on my breast to remove what they suspected was cancer. It was benign. But either way, I woke up during the surgery, and I looked up and saw 4 people with scrub caps on, staring down at me. I looked at my in pure horror, and that is all I remember because they knocked me back out. Still makes me want to vomit thinking about it. I was only 13. Story 20. During my 3rd year of medical school, I was stitching up the wound after breast cancer surgery, and the anesthesiology nurse woke the patient too early as I was making my last stitch, and I felt the patient moving her arm and trying to sit up. Patient was still covered in surgery draping and cables and still intubated. Luckily, most people do not remember much from the first moments after waking up, but I got quite nervous from the patient starting to move. Story 21. When I was in pharmacy school, I was doing my internal medicine rotation in my final year. My preceptor and I were doing med reviews in the ICU when one of the pulmonary docs was basically like, "Hey, you want to see something cool?" They were trying to extract a foreign object from a guy's lung in one of the rooms. So we go in and watch for a bit. About 6 people in the room, tube down the guy's throat. Little grippers at the end. 2 doctors watching a monitor and trying to control the grabbers and get it like a claw game. I watched for a bit, then, after a while I lost interest and went back out to what I was doing. A few minutes later, I hear, "Got it." Cheers from the room. "Oh, it's a tooth." Dude aspirated his own molar. Doctor walks out with his trophy in a jar, and it's a completely intact tooth root and all. Story 22. Just an RN here. I was working in the ER and had a patient brought in by her husband. Apparently, the woman had a fall a week prior and injured her face but refused medical care. Her husband finally forced her to come in. As soon as I see the wound on her face, from across the room, I think, that does not look like any wound I've seen. I approached her and realized maggots had infested the wound and were eating the rotting skin. A really simple and quick fix, but I can't imagine her living conditions. Story 23. Sorry in advance for this being so long. Not a surgeon, But my mom had to have a kidney removed due to her waiting for almost 2 years to go to the doctor about her pain in her back. The doctors found out it was a large kidney stone and that her kidney was infected and had lots of gross pus shutting it down. After draining the fluids through tubes over the course of a month and a half, she was finally ready for surgery. Cue last Wednesday, the day of the surgery. She was ready to finally be done with it. They removed the stent put in and the tubes no problem. Next was the kidney. Here comes the oh shit moment. As they get ready to remove the kidney, there was complications. The kidney's infection had spread to a portion of her lung and a major artery, making them fragile as toilet paper. As the surgeon removed the kidney, a hole was torn in the lung, and even worse, the artery was severed. At that point, it was a race to save her life and stabilize her. I don't remember much about how they fixed her up there, but they had to fly her to a different hospital and have a heart surgeon fix the severed artery in a more permanent fashion. Anyways, the heart doctor saw the grave situation and said, she's got a 1% chance for her to make it. But he did such an excellent job that my mom is still alive and getting stronger each day. The moral of this story is, if you have insurance and are experiencing pain, go to a doctor as soon as you realize it. You may save your life and also save some doctors from an oh shit moment like this. Story 24. Not a surgeon, but when I was in nursing school, I was observing a tonsillectomy when the power went out. Everything switched over to the backup generators, except for the suction, which is incredibly important for any surgery, but particularly in the throat, aspiration risk. They ended up having to connect a giant syringe to a length of suction tubing to suction manually, while someone went to the other side of the building to find portable suction. Luckily, ours was the only theater that had started operating that morning. Story 25. Former medical student here. Rotating through general surgery was mainly an enjoyable time. I remember one young patient, 22 years old, was revisiting the ER, where he'd been seen 6 weeks prior for sustaining some abrasions and bruises after falling hard off a skateboard. He was all scraped up everywhere but had healed up okay. But now he's in the ER again, feeling awful sick, vomiting, and with a fever. As the third-year med student, I was dispatched to the bedside and hung up the CT films on the light box, to much finger-pointing and grunting among the surgeons. I had no idea how to read a CT at the time, wasn't even really sure what part of the body had been scanned. So when the surgical resident barked, "Prep him for surgery," I was nonplussed, decided to disguise my ignorance and just go for it, as was the approved way for students at this busy public hospital way back when. We got him gassed and prepped and I scrubbed in. Surgeon said open, and I raised the number 15 blade. He'd been prepped for a midline laparotomy, but I guess I exposed my ignorance when I spoke up to confirm same. This was decades before timeouts, before wrong site became a never event. Because everyone laughed. I opened and it went uneventfully, reflected the omentum with its lovely arcades and exposed the viscera. "You remember how to perform the Coker maneuver?" the attending barked. "Yes, sir." "Well, do it." I slid my gloved hand up into the splenic flexure, getting well ready to grab the entire sack of intestines and move it up and over. The opening salvo of the Coker maneuver, but met unexpected resistance. I peered up, seeing in my confusion that everyone was edging away from the table. "What's the trouble, young man? Get your hand up there and complete the maneuver. Push harder." A spongy sort of barrier gave way, and with a sickening stench, immediately recognizable as the locker room aroma of Staphylococcus aureus, a gushing cascade of 2 liters of gray-brown pus roared out of the incision, soaking my gown, scrub pants, and shoes before splattering on the OR floor and walls. The splenic abscess, doubtless caused by the transient bacteremia from his skateboard accident, had been lysed, ruptured, evacuated, and mostly cured. The attending finished up with the splenectomy, and after some abdominal lavage, the patient was good as new. I had to throw out my shoes. Story 26. As the patient, I hope if the oral surgeon is on Reddit, they posted this story. Wisdom teeth removal. All 4 impacted, gotta break out the heavy hardware. I'm knocked out, don't even know the dentist entered the room. I wake up but not able to move. Just eyes open awake, but my limbs won't react to my brain. I can feel the dentist hammering a chisel into my tooth to break it for extraction. My jaw is just coming undone on every hit. My eyes are wide open, jaw even wider with some evil metal contraption. I'm staring at the assistant, begging for her to see me, and after about a dozen hammers to my jaw, she glances over and drops the suction, jumps up and shrieks. The dentist stops to look at her, then looks at me and I see him say, "Oh." Next thing I know, I'm waking up post-surgery. Shit that nightmares are made of. Edit. Lot of replies. So this was a military dentist. Yes, they put me under and no insurance involved. Not sure what they used for anesthesia. Yes, I could feel pain from the impact, but not nerve pains in the actual tooth. Story 27. This is by far the most responses from the actual profession that is being asked that I have ever seen. This is interesting. Usually they are like lawyers of Reddit. Then 928484 people are like, I'm not a lawyer, but I train ladybugs, and this and that. Story 28. Not mine, but my father's. He told me this back when I was 10, so I'm sorry if it doesn't fully make sense. He had a 21-year-old patient that needed to have a penectomy. He had cancer of the penis. There were two oh shit moments for this. The first is a common thing. He wasn't fully asleep. The second, however, is funny and humiliating. They are about to start the surgery. Suddenly, one of the nurses that was there suddenly threw up and left. A test later, and boom, she got knocked up. Halfway through the surgery, the other nurse leaves for a call about her father. My dad's just standing there, a half-gone penis in his hand. He calls for help and is standing there, a guy's penis in his hand for 30 minutes. Story 29. I was a fourth-year resident and I was on call that day. Around 5 p.m. I went to do rounds, and as I got to the first room, I came in to find the first-year resident on top of the very recently neck-operated patient. That morning, he had a tumor removed from his parapharyngeal space. The resident was kneeling next to the guy's head with his hands and clothes completely covered in blood. There was blood on the roof, on the sheets, on the bed, dripping onto the floor, you name it. I was instantly petrified. I went to OMFG. I have never ever repaired someone's carotid artery. I am completely unqualified to help this guy. Someone please help us. I was the senior resident, so I was the only one on call at the time, and besides, none could get there in time to help this guy. He was bleeding out, so it was up to me alone to help him. So I took the guy to the OR as fast as we could and I opened him up, all of the time praying and telling myself, it's okay, I can do this, I can do this. I was shitting my pants while everyone was looking at me to fix him. I open him up and I see the freaking facial artery loose, spraying blood all over, so I clamped it, put a knot around it, and that was it. We closed him up, bandaged and transfused the poor guy, and I went to collapse on a stool. Story 30. We operated on the carotids of a patient, like gaping hole in his neck, when the patient woke up. Easy Fix was shouting at the anesthesiologist, which wasn't there. Had to hold the head with my elbow so he wouldn't move too much and kill himself. Story 31. Not a surgeon, but the patient. I was around 13-14 and undergoing gallbladder removal. Almost unheard of for someone my age to have gallstones bad enough to need a removal. But anyway, I was extremely underweight and sickly. The anesthetist gave me an adult dose of anesthesia and knocked me out for about 8 hours when it took the surgeon about 40 minutes to complete my surgery, so there was a lot of panic that day because no one could wake me up. And I was pissed off when I woke up because I couldn't feel my left arm with the IV in, and I really needed to pee. Tried to get up to go toilet and ended up on the floor instead. LOL. They also got me a pot that I refused to use.